I'm Diana Workman, and I was diagnosed in July of 2013 with HER2-positive stage 2 breast cancer. In my original, very first meeting with my general surgeon that I dearly loved, he told me he wanted the very best and he wanted me to come to PRMA. So in that way, I don't think I'm like the typical PRMA client that came and did a lot of research and had really done their homework when they got here. When I got here, I was still in the middle of my initial 2-week testing. I was really quite afraid that I might not live. And I'm pretty sure if Dr. Nasala had said, we're going to need your right arm to fix this, I would have said, okay, great, you can have it. Thankfully, that did not happen. However, my cancer, my tumor was large and it was aggressive, so I was not a candidate for immediate reconstruction, which I really would have liked to have had. But that's okay. I went forward. I had that mastectomy, so I had that loss immediately. And then I started chemotherapy and lost my hair, and then my fingernails started to lift. So I felt like I had lost every feminine part of me. There wasn't a day that I went by that I didn't wear pink lipstick, have my toenails painted, and big earrings. I did not want anyone to think I was a boy. Got through all the worst of that, and it was time to reschedule my consultation because we were kind of starting over now that I looked different than I did in the first place. And came back, and by then I was more a typical patient. I had done my homework, and I knew that I was really, really grateful to have PRMA right here in my own backyard. And Dr. Nasala was awesome and amazing and just listened to my fears and my complaints and whatever and took care of me totally. At that point, I was not willing to give my right arm anymore, but I was very willing to give tummy fat to recreate the breast that I'd lost. And so that went forward, and we did the surgery. It wasn't that bad, and got through with it. And I was at my last appointment to have my last strain out with Amy, and oh my goodness, she's the best. She's most awesome. And she told me I could go be fitted for what I lovingly refer to as my big girl bra, because I had been in leisure bra, I had worn the prosthetic bra, and none of those are any too sexy or too beautiful in my opinion. And she told me I could go to a real store and be fitted. And so I went that very day straight out to Nordstrom, and I found a lady that had done it before and for reconstruction patients, and she did all my measurements. She took care of me, and she picked out the bra, she brought it and helped me get it all on. And at that point I was checking boxes. I was just, you know, in order to get past cancer, you have to have a mastectomy check. You have to have surgery check. You know, you have to do chemo check. And I had just checked all the boxes, and I really hadn't stopped to think what that was going to look like. And so the lady got me all dressed, and she turned me around to see if I liked it. And it was the most emotional thing, and I totally was not expecting emotion at that point. Tears are running down my face. They were running down her face. And it was the first time in 7 months that I had seen the reflection of a woman in the mirror. And I was so grateful. First, grateful to God for saving my life, and then grateful to Dr. Nasala for putting Humpty Dumpty back together again. So I will be forever grateful to Dr. Nasala and PRMA.